Tension-relieving suture patterns spread out the tension within the tissue and are less likely to pull out. They also tend to evert the tissue. The cruciate suture gets its name because it forms a cross. To perform a cruciate suture, pass the needle as you would for a simple interrupted suture, and then take one more bite next to the first bite. The pattern is then tied with an instrument tie. Because this suture is used in areas of tension, a surgeon's knot is commonly used in combination with a cruciate pattern. Watch as several more cruciate knots are tied. The horizontal mattress is a tension-relieving suture pattern and causes eversion of the edges of the tissue at the incision line. A horizontal mattress can be an interrupted or continuous pattern. For the interrupted pattern, a bite of tissue is taken across a wound and the needle is removed from the tissue. The needle is redirected in the opposite direction, moved a small distance up or down the incision, and a second bite is taken. The suture is tied such that the knot is on one side of the incision. Because this suture is used in areas of tension, a surgeon's knot is commonly used. Notice the eversion of the tissue, and also notice that the horizontal mattress can create a square of tissue that may become ischemic if the suture is overly tight. Watch as additional interrupted horizontal mattress sutures are tied. The vertical mattress suture is a tension-relieving suture pattern. It allows for better apposition of the edges of the wound compared to the horizontal mattress. This is an interrupted suture pattern. To maximize the effect of this suture, try to take the first bite a good distance from the incision. This will help pull the tissue towards the incision and minimize tension. You will need a larger needle and may need to exit the incision and then re-enter on the opposite side for the first bite. To perform a vertical mattress suture, take a full thickness bite of tissue as far from the incision as your needle will allow. It is normal to exit the incision and re-grab the needle to complete the first pass of this knot. After the first pass, the needle is redirected in the opposite direction, and the second pass is made directly over the first pass. The second pass can be a split thickness bite to more accurately align the tissue layers. The knot is tied on one side of the incision. Vertical mattress sutures may dig into the skin on either side of the incision, and for that reason are frequently removed after 3 to 4 days. They can also be used in addition to other suture patterns, but only in areas of increased tension. Watch as additional vertical mattress sutures are placed.